Good morning and welcome to Fridays on the Porch. I am your host, Dr. Katie O'Shea. Welcome to our podcast, an unscripted, unedited, uncut conversation with local leaders and healthcare practitioners who are looking to help advance ways to find balance and bring it into our lives in a holistic capacity. Today, I am very excited to welcome a longtime friend, mentor, and colleague, Cheryl Ditzel, family medicine nurse practitioner and owner of South Jersey Integrative Medicine. How'd I do?
You. You did great.
Yes. All right.
You did great.
Cheers.
Thank you so
You're
much.
welcome.
Cheers.
Welcome to the porch.
It's beautiful here.
It
Thank
really
you for having me.
Oh my gosh, thank you for
I really
joining me.
appreciate it.
I'm glad to be here with you and appreciate you being here. And I just need to come clean.
Sure.
It's not the morning. It's not Friday.
No, it is not.
I feel like
we roll with the punches.
we do. We roll with the punches, but it's 80 degrees today.
Right.
And there was just no way that we weren't going to be outside today.
Correct. Yes.
But I'm seeing the sunset. I'm going, we're not going to make it.
I was thinking during your intro, I'm thinking, oh boy, I mean, it definitely doesn't look like morning when you see the light changing.
Sure doesn't. Yeah. Opposite morning. It's morning in Australia, not morning here in New Jersey. So now that that's out in the open, the lies are off the table.
It's all out there.
It's all here. Welcome to the porch. Welcome to our little porch cast, if you would.
I love it.
So how are you?
I'm very good.
Yeah.
Very good.
You've been up to a lot recently.
I have been up to a lot. I just got back from Arizona, which was a week in an integrative medicine fellowship that I'm very excited to be a part of. I
should be and proud of.
I'm overwhelmed. I'm blessed. I'm excited. I'm nervous. You know,
these
all
actually sound healthy.
Very, very healthy emotions. Yeah. You know, we're supposed to have all of the spectrum of emotion.
Sure are.
In nice amounts at, you know, appropriate times.
Right.
And in order to teach that to clients, patients, friends, family, myself, I need to walk the walk, talk the talk.
I love that.
Yeah.
And this is, I think, an exciting thing for your practice, for accessibility for patients.
It is.
And so our journey goes back to, I met you probably in 2006-ish area.
I think that is correct, yes.
When I was a baby PT, wide-eye, in the ICU. Who lets a 23-year-old out alone in the ICU? Can we just talk about that right now?
We generally don't like free roamers, you know?
Yeah. That here I was. Hi. I'd like to see your patient.
Right.
Is their EVD open or closed? And Cheryl was like, come here, child.
Exactly. Like, let me tell you so we don't hurt anybody.
Right?
Yes.
And just brought me under your wing and took all of my questions I knew I had to ask and helped me understand what that looked like clinically, you know.
Yeah. So that
was your journey.
That was my journey. Started being an ICU nurse for the majority of my in-hospital career. I became a registered nurse in 1997.
Okay.
Oh, wow. Can't even believe it. And I really credit my ability to flex throughout my entire nursing career to one of my very first clinical instructors, Tina Campbell. I'll never forget her name.
Oh.
And
Hi,
she
Tina.
Hi, Tina. I hope you watching, or actually I'll send it to you. She would come in the morning with a big gulp cup in her hand and tell us to jump on the grenade, which meant you take something that scares you because we need to get comfortable with the uncomfortable. Huh. And you are a student. I am, your teacher. I will help you and protect you. Now is the time to take the risk and let yourself out there.
It makes a lot of sense.
It does.
Because you don't really know the fears yet.
What? You don't. You're just afraid of everything.
Right. Everything is level 10 cortisol. Right.
Right. So you see a new face, you're afraid.
Right.
You walk into a new room, you're afraid.
They move the IV bags.
Oh, exactly.
Fear.
The call bell goes off. You're afraid. I mean,
terrified.
Everything.
Right.
Everything. So she was amazing to me.
Oh.
And I said, okay. And that's really all I needed to get her support, was to be willing to follow those directions. And she delivered.
That's beautiful.
And I actually taught my entire career, and I used the same, tenets or the same, rules that said, if you're willing to work for me, I will protect you. But I'm going to show you all the things that might scare you, because right now you have me to back you up. Now is the time to do these things.
And that's the perfect mentorship. You can't
Yeah.
ask for anything better.
And people think, is the student getting all the benefit? That's not true. You as the mentor are learning.
Absolutely.
Because they're asking you questions that you can't anticipate.
Mm-hmm.
And their didactic is fresh.
Yep. They know the research.
They know the
current
research.
practice.
They know the latest guidelines, from their robust nursing program, hopefully.
Mm-hmm.
And I haven't seen a lot of discrepancies there, which is really nice to see.
Yeah.
And when we do, we make sure that we have a conversation about it.
Yeah.
And that's what it's about, because you're never going to stop learning.
No.
When you're providing healthcare,
Nope.
when you're treating patients or clients, you're never going to stop learning. You're never going to be not afraid.
No, never.
I mean,
the fear doesn't go away.
No.
You just learn to deal with it.
You
and
learn
how to
to
cope with it. Mm-hmm.
You learn how many tools are in your toolbox.
Yeah.
So the more tools you can collect,
right,
the better. And
more
that
knowledge.
Is one of the kind of tenets of integrative medicine is, we do, A, B, C, and this, and that, and the next thing. So it could be diet, hydration, sleep, relationships, community, so that connection, the whole person, mind, body, spirit.
And that's what I love about integrative medicine piece, right? I love healthcare. I will be a PT till the day I die. It's in my brains,
Mm-hmm.
my brain and blood, right?
It is.
But we treat system.
Mm-hmm.
We treat diagnosis.
Mm-hmm.
And sometimes there's more to it, right? Why is there the chronic pain? Well, it's because of an emotional issue and there's trauma stored, right?
Correct.
This is so much more your domain than mine.
Yes.
And that's not what our healthcare system set up. So people just kind of cycle through.
They do.
And that roller coaster, and they get stuck.
It becomes the rinse and repeat.
Mm-hmm.
And part of that has really grown to be common because of the time constraints in the conventional setting.
Yeah.
And that has frustrated me from even the in-hospital experience, the bedside experience.
Yeah.
And I think one of the reasons I gravitated to the ICU earlier in my career is that I had more time to spend with one or two patients and could read their chart, talk to their family, really find out what was happening.
Okay.
Or have time to bond with the patient if it was a trauma patient, which was really I'll admit it was my favorite service.
And I would say you excelling on trauma.
Yeah.
So
trauma and neurosurgery were my favorite services. And also learning from them that, the body's complex.
Mm-hmm.
Trauma patients, all of them are puzzles. So you have to figure out what pieces need to fit, what pieces don't fit,
what pieces are now titanium.
Exactly. What pieces are now given to you by, our hospital surgeons. So true. And then neurosurgeon influence, teaching me we know about 20% of the capacity of the brain, and that's probably generous. So, and that's coming from a chairman of academic medical center who was and is top of his game and earned his experience, his rightful arrogance, because you need that.
There's a level of
arrogance
needed to be,
and confidence that you need to have that's not detrimental to the patient or the people around you. And he was delightful and still is, and taught us that the brain is complex and it affects every single cell in the entire body.
Right. Sure does. All connected.
So
all those axons.
Years later, I decided I didn't want to stay in the acute care setting.
Okay.
Much to the chagrin of most people that work with me. They thought, you live, breathe acute care, trauma, neurosurge, surgical ICU, transplant. What are you going to do?
Right.
And I said, well, I want to do primary care, and I want to do, full primary care, which meant cradle to grave, infants to centurions. And that's what I went and got my master's degree in that and passed the boards.
Okay.
And did conventional primary care for about 9 years. And each year got harder because each year we were under more pressure to get people in and out. And I was actually a lucky person.
Okay.
Because the offices that I worked in allowed us to have more time. They were privately owned.
And now what's more time?
So 15 minutes for a sick visit. Okay.
Oh.
Now, with the way many programs or many mentors are teaching this now is 7 to 8 minutes with the face-to-face with the patient. The rest of the time is documentation.
Okay.
Because it's become very cumbersome in order to get paid.
Right. All the
regulations. All the regulations, making sure you have what you need in your note, and clicking all these little boxes to get to something that you probably could have handwritten a lot faster.
Love the boxes.
You know,
you say handwriting, off topic here, but Epic went down twice this year. Can I tell you, I was the best.
You were probably the best resource.
I was, right? Best resource. Me and my wrinkly skin. Well, not wrinkly.
Well, we age ourselves when we know when's the downtime binder.
Right? We know the down, and we have pens on hand.
Yes.
Right? But, oh my gosh, you can still crush a note in 5 minutes.
Yes. It's faster.
It's so much faster.
It's so much faster. And, one of my private offices, we did not have EMR. So I handwrote my notes.
I kind of like that.
Which I love.
Yeah.
And I still struggle with EMR systems because, it just doesn't capture like what I wanted to capture. And also the level of how I feel about the importance of certain subjects or certain things. It says more when you're handwriting something out.
A little underline.
Exactly.
A little highlighter, different color pen.
Right.
Yeah.
Right. Or even just giving the patient or client a handwritten note, on a script, which I love to do. I still do this.
Do you?
Oh, absolutely. You'll say, remember, coping strategy that worked for you before was journaling. You've fallen off. We fall off of good habits.
Absolutely.
Now it's time to start again. I want you to go back, and that's your homework. So I give them a homework list.
And that probably has a lot of weight because now you are the provider giving them the prescription.
Right.
And I better put this on the fridge. I got to fill my script. I got to, she's going to ask me about this.
I am going to ask you about it, yes.
Yeah, and you probably do it.
And I do. And I copy that and I put it in EMR even. And so when they come back and we go through their plan of care from the last visit, I go back to the last note and I say, look, this was our list. And look, this was your homework. So how did that go? You
didn't even give me homework, and I feel guilty like I didn't do something.
Right?
I'm like, was I supposed to do your homework? Right?
And I have homework too.
Right.
So and I like when they keep me honest on my homework
as the provider.
Right? Right. And it should be a two-way street, and I like that. I like that interaction. I like saying, well, we have 10 things that I project or predict are going to be problems for you with your wellness or your ability to function the way you want to. So you pick one and I pick one. And these are the things we work on.
I love that.
And we do it in order of severity. So if there's something that's imminently going to hurt you.
Right. Your blood pressure is 200 over 150.
Exactly.
Right.
Then I will push. And I tell them, I'm only going to do that when we need to do that. You are in danger.
Right. Which you want your provider to be looking at for you and saying, we're going to do these things.
Exactly. And I'm very clear in the beginning when I meet people, because I want to be a fit for you and you should be a fit for me.
I think that's huge. So huge.
And
it's not just, you're in network.
Oh.
And your appointments aren't 6 months in advance. Ahead of schedule. Right.
Right.
That's huge.
So, I was able to flex my time a little bit. I would put patients before my lunch break.
Okay.
I would put patients, the first appointment, but basically say to them, come at 20 minutes early. I'll open the door.
Wink, wink.
You're coming in. You know what I mean? Because I know, in order to get it fit into the day, to squeeze it in to, a mold that doesn't really work.
Yeah.
And so I made workarounds.
Okay.
But the problem with that is, as the provider, you will burn out.
Yeah. How long does it take you to realize you burned out?
I kind of knew I was burning out.
Okay.
But I was still doing coping, still trying to do those things. I would say I knew I was burning out at year 6.
You did pretty good.
And I, decided, okay, I'll cut back here. I'll do this. I'm going to advocate for myself. I'm going to learn how to say no to other things that didn't serve me in my life.
That's huge.
Huge
boundary.
Is gigantic. And most of I have to practice this because, as a healer, you don't want to say no.
Right.
It's not in your makeup
because you're wanting to help.
Exactly. and sometimes that's very difficult. And I'm sure you find that when you're with patients, like you have to figure out, okay, I need to serve this client, this patient, but I also can't serve anyone unless I'm 100%.
For me, right? It's our grounding.
Yes.
It's our not taking it home. I was just talking with one of the PRN, with the therapist the other day when I was working as a PRN. And they were talking about a patient that we've had, for some time. Like, don't you remember them? And I said, I don't. And it's not early dementia, although I do worry about that sometimes. I literally just shut off when I leave, and I leave it. And that's the beauty
It's emotional
of PRN.
distancing.
Right, it is.
Yeah.
And it's the only way for me to stay boundary protected and away from it. Because if not, it'll drag me down. Because it did in my PT career, probably year one.
I mean, I would have a running list of what I'd call my specials. And these were folks that I knew there was something wrong. The conventional testing was not elucidating the problem, So we would do all sorts of,
they were
mainstream testing. They come in and I'm like, well, on paper you look great,
but you can't walk.
Right, exactly. So not really sure why the tremor's there, not really sure you're in chronic pain,
right?
Not really sure why you're having panic attack. Why, and
you're blind. I don't know.
I mean, you name
20/20 vision.
Any symptom you could think of, and I've heard it, and I couldn't. I didn't want to be the one to say, well, I have nothing for you, And so I started doing my own digging. And so I would research, I'm like, what else can I do? Is there a way I can expand this, to more of a whole system, a whole person view? And that's when I found a functional medicine program. And I, looked at a lot of different programs. I was time constrained. I was like, okay, I'm going to just dive in. I'm going to, speak to some of these program directors and see what fits for me. So I picked a program. And I got functional medicine certified, which was an eye-opener for me.
I bet.
And basically what that style of care means is you're looking for a root cause of a disease that's presenting, or the root cause of a symptom cluster.
Okay. So I come in with you, my right knee hurts, I have a headache, and I can't sleep. But my x-ray looks good. Right. And I'm eating fine and healthy, but here I am.
Right. So
fix me.
So ironically, that cluster of symptoms, we're going to look at a couple things. We're going to look at your lower back. We're absolutely going to look at your reproductive system. Because oftentimes, so if we thought it was your lower back, that radiates to the knee.
Right.
Okay.
Sciatic, differential diagnosis.
Absolutely. We're going to actually physically examine you. I know it's a surprise, but we're going to do that. So we're going to put you through some paces. It's not just going to be, oh, I'm going to listen to your heart and lungs. I'm putting you through like a physical challenge to see what is going to make the pain, bring it on.
You're trying to exacerbate it.
I'm trying to exacerbate it. I'm trying to mitigate it. I'm trying to physically, find the spot where it's being generated from.
Right.
And maybe even find some things that help take it away, when we're together.
Which is beautiful.
Which is a beautiful thing. Right? If we can figure that out.
I mean that's a win.
Then
then
we're ding, 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 Sometimes it's more complex. So then we're looking at, the pelvic girdle, the reproductive system. Is stress making you clench your entire body? And as women, men too, but women much more, we hold it in our core.
Right, our pelvic.
In our pelvis. So when we are clenching our muscles, we're actually also vasoconstricting our blood vessels.
Right.
So it's causing, blood flow to be diminished to those areas. So, and think about what that's doing to the brain. Focus is away from the brain. Focus is in our midsection. We have a lot of organ systems there. The body's doing its system check, like you rebooted your computer or you turned your phone off and on, which is my favorite fix for any kind of technology problems. Just turn it off and turn it on again.
And technology problems do love you.
They love me. We had one when we started here.
We did. My phone wanted to call 911 for us.
Just spontaneously, because that's what happens. I've been known to shut CT and MRI down for no reason. I mean, you name it, it happens. No metal in my body, go through the airport, always get tagged.
I'm waiting for the phone just to implode right
second. Exactly, yeah.
Right, like my cortisol is like a 7 right now. I'm like, here we go. I didn't save the other podcast yet.
It's just going to leap out of the stand.
Yep,
something will happen. Gosh, I totally lost my train of thought.
Rebooting the system.
Because we're having so much fun.
Right,
Well, I just rebooted my system.
You did. Mm-hmm.
So rebooting the system. So the body's trying to figure out, it's doing a system check. Like, where is this coming from? What is happening? And that is what it's supposed to do.
Right, because our body wants to heal ourselves.
Yes.
We have 80% capability to heal ourselves.
We absolutely do. So when we are having symptoms, it's telling us something is wrong. So we don't want to always put a Band-Aid over that or take that away right away, because we need to figure out, what is it? What's happening?
Right.
So if we take the signal away, now we have no data.
None. And we're actually creating trauma.
We are.
Which then stays locked in the muscle.
Correct.
Which
and it's going to refer somewhere else.
Sure is. Which
because
is probably
it's going
a part
to say,
2 episode.
It's probably a part 2. Exactly. Exactly. So then we give you meds, which there are times for meds. Absolutely. There's times that we give something that we either put on our body, inhale, we put in our mouth, we swallow. There's a number of things that we can have. We put in, we put an IV in, we give you something that's IV, we put something into the muscle. I mean, there's all sorts of ways to deliver an intervention. Okay.
Right.
So anything that we put in on, in any way could affect us positively or negatively. So the whole story of the patient it doesn't have time to be told.
It doesn't.
If you have 8 minutes and you're trying to get, facts out of somebody, or just like the basics to try to figure out what to do for them, because you're running them through the mill, you're not going to get the whole story.
And the person doesn't trust you.
Correct.
Right? And we make our first impressions in the first 30 seconds of meeting someone.
Yeah.
So if you're, not you, but if the provider, is coming into the room with, a laptop and a coffee cup and they're all over the place, me as the patient is going to be like, they don't have time for me.
Right.
They're not going to hear me if I tell them anyway.
Correct.
So I'm going to tell them the version of the symptoms Google told me I had.
Exactly. Because Dr. Google's always first to be consulted.
1000%.
Now AI. So,
Oh yeah, ChatGPT.
Oh my goodness. So it's very interesting. I play with that just to see.
Do you?
Like what comes up.
Yeah.
And it does get smarter, but boy, like it's interesting. And obviously there's capabilities for all of these things in life. It's when to use them.
Right.
It's when to use them. And that's something very difficult as a provider, when to use things that are in our toolbox. And it's no different whether you're a conventionally trained and conventionally operating NPPA physician, MDDO, whatever your gateway into medicine was, PT, OT, speech and language. I mean, any of these things. So it's very interesting to me. We can still be bad providers in functional. We can still be bad providers in integrative.
Yep.
If we throw all the, the spaghetti on the wall and hope something sticks,
you're not really teasing out.
You're not really doing the best job you can do. And really a lot of it is in the conversation. The patient or client has the answer.
100%.
So if you ask the right questions, and be tenacious about it, it's going to come out.
And you get curious.
You do.
I remember Dr. Howard, my orthopedic instructor, and that was the first thing he said, your social interview is more important than your physical exam.
Yes.
Because they will tell you.
Yes.
And it is true to this day.
And how they walk into the room.
Yep.
How they sit. Where they put their hands. How they get up. I mean, sometimes I know exactly what it is before they even open their mouth, because they are doing the nonverbal cues.
Right.
Already.
It's like, look at me.
Yeah, they're already showing me the way they stroke their back.
Yeah.
I mean, it's very interesting. Shingles presents like that often. Yeah.
That's a fun one. This should be a part 3 of our podcast is going to be guess the diagnosis.
Yes.
And I'm just going to
we'll do visual cues. Yes. Oh, it's perfect. It's so fun. Yeah.
Oh my God.
It's so fun.
This is going to be great.
Yeah. And you'll look like a magician.
Okay.
Like, how did you know?
I just knew.
Because there's tells for this.
Okay.
Yeah. So people, and that is the body recognizing it. But because all of this has been driven out of us, starting as children.
We're told,
you're fine.
Don't cry.
Right,
don't listen to that. You're fine. Whatever it is, we're not given the space to truly listen and check in and figure out how to regulate.
Exactly.
Right?
And when you know, the people around us are poor regulators. We pick that up.
Oh yeah.
Yeah.
And then everyone's like, I don't know why, but you make me feel okay.
Right, exactly. Yeah.
And you're like, you can be there too.
Right. Like there's a space for everyone here.
There is.
You know?
There is.
People that know me, really, we talk a lot about feelings. So, and you know, they say that I say, "Welcome to the land of feelings." I'm the mayor. Welcome.
She's very welcoming. Very, very welcoming committee.
I am a very, very good welcoming committee, and patients, family members, friends will say to me, "Damn you for making me feel stuff."
Remember, unscripted, unedited.
Yes. Okay.
Unedited.
Bleep. Bleep.
I feel things right now, like the FCC.
I picked a soft word. Soft word.
She means like beavers.
That was a quote.
Making sure there was no water coming down the hill.
They're amazing, right?
Right, yeah, okay.
I mean, look at the homes they build. It's pretty amazing.
Oh,
yeah,
great.
So I wanted to give a shout out to those little guys.
A&O by 2, guys. Clearly our exam.
I'm going to take you off air already.
Only on episode 11.
I mean, really.
I know.
It's a little early.
Whatever, we're getting spicy on the porch. It's Porch After Dark, folks.
Exactly. Yeah, there you go. Right.
So anyway, back to the
core.
Yeah.
So, you know, some of this is like giving people the permission to feel. And I see this almost I would say almost every day that I practice. Someone will come in and they have an anxiety disorder diagnosis, or they have a history of depression or mood disorder, or a history of, you know, inability to regulate the nervous system, you know, and they come in and I say, "Ooh, okay, what's going on? I can feel that you have something you want to unpack today.
Yeah.
So maybe we do this first because this might be a priority for you." And, you know, they'll tell me like, "Oh, my grandmother passed," or we have a site visit at the hospital.
Oh, Jacob.
Exactly.
Put the water bottles away.
Like, oh my gosh, you know.
Kidney infections for all.
Right, exactly. And they're, you know, reacting to this. And I said, you know, just because you have these things in your history that we have demonized, that doesn't mean that you are not supposed to feel this emotion. You are. This is your body getting ready. So embrace it. Let go, embrace it.
It is. Tears are healthy.
Yes.
They're healing.
Yes. Cathartic. Use some coping mechanisms to shake off that feeling. You know, and what about breath work?
Love breath work.
You know, what about using water? You know, that is amazing. People do it all the time and they don't even realize it. They just get up and say, you know, I'm going to just go wash my hands. I splash my water on my face.
Yep.
That
wash it away.
You just did. You just did a healing exercise for yourself.
Sure did.
And look how simple that is. Just, you know.
And that short
20,
moment in
30
time.
seconds. Just going in, splashing a little, pat, pat, pat. You walk out, take a couple deep breaths. Whew,
right.
And out you come. And people will recognize, you look refreshed. What did you do? You know? And it was just that simple.
You know what's something that's interesting with me and in my own journey for, you know, healing and all those things? I think I used to think it has to be perfect the first time.
Yes.
Right? When I journal, I'm going to feel better.
Yes.
Right? When I take a shower and wash it away, I'm going to feel better.
Yes.
And it's not so much that it fixes it forever as much as it creates a break in that anxiety, right? Cascade. Yes. And it makes your brain go, oh, there's another pathway I can develop here. What is this other pathway?
Correct.
So it's the compounding of all of it. It's not one face wash. It's not one journal. It's not one sticking your feet in the ground, right? But it gives you that little bit of that glimmer that, life can look a little different.
And I like that you said about the pathway, because that is the idea, that we are building a new neuronal network separate from that persistent negative pathway that we have found ourselves in.
Yeah.
And we all do it. I mean, I teach it, and I fall off the wagon. I find myself doing it.
Absolutely.
You know? And so when I don't do my self-care, I recognize like, ooh, that's an old pathway for me. That's interesting. Why is that? Why am I there today?
Right? It's a curiosity question. How did I get here? Why doesn't this feel good?
Right. So did something remind me of something, or, you know, it's reminding me that my coping mechanisms maybe are not working right now, or I haven't been practicing them. You know, there's a cute doggy in front of us.
There's a cute dog. Oh my gosh. Oh, we
Awesome.
love that. We're taping a Porchcast, so he's more than welcome to be on our podcast. Yeah. Oh my god. Well, we're done.
Cute.
Yeah. Have a great night, guys.
Yeah, we're like, see ya, there's a dog here.
The second dog today. Why does the universe give me such gifts?
See?
Oh, hello, furry friend.
Well, what is this? That means we're in the right place
The tail
at the
swagging.
right time.
We're happy.
Which I actually think the phone message when we first got on, where it just clicked,
Call for help.
Call for help. I think that is just saying that people need help, and that's why we're here.
They're calling us.
Yes,
Okay.
I do. That we are called to this spot at this moment.
I
Because
like
remember,
that.
messages are sent to us in very unique ways.
Very.
And sometimes we want to take the literal meaning.
Sure do.
Right?
Yep.
And it's not always that.
It is.
Yeah.
It's funny you say that. Messages come to me in form of bird feathers. It's always been. And one of my friends has said to me, I don't know how birds aren't bald because of you. I kid you not. Like one day there was 30 feathers in my backyard.
Wow.
The birds all seemed fine.
Right.
But there were feathers. Literally
That's
a Ziploc baggie full of
interesting.
feathers. And I was like, oh, I guess I'm
Wow.
supposed to listen to something today.
You know, do you see certain birds at certain times, like poor things?
Oh yeah, I'm the bird lady. Yeah.
When I haven't made a decision
Mm-hmm.
that I know is the right one for myself, I will see crows. They'll sit on my car.
But you know, crows aren't really bad.
No, I know. They're telling me. They're
telling-
supportive.
Yeah.
They're like, Cheryl, we are here for you.
Mhm.
Yeah. Like, it never feels like a bad omen to me.
Yeah.
It feels like, oh, like today is the day.
Mhm.
I need to address this today.
Yeah.
Like, I've been putting it off.
Yep.
And the universe is sending me one message after another,
Yep.
saying, you know, and that's actually, you know, what was happening when I decided to go, you know, into functional, and then, you know, explore the integrative piece, which is really a larger umbrella of taking into account the mind, the body, and the soul. So, and it's a lot of motivational interviewing with, you know, the person that you're with, your client, your patient.
That makes a lot of sense.
Yeah.
So what do you think for folks who are curious, right? Who are saying, maybe I want to look into integrative medicine.
Sure.
What would you say are the top 3 things they should look for in a provider?
Okay. I would say number 1 would be what kind of training modality or training mission statement do they have? Because I think that's really important. And for myself, it is allowing you to get back to the highest function and the ability to align all your wellness goals over the journey of your life while you are making conscious decisions to say yes to yourself and show up every day. And that is what I look for. So my patients have to be as good of a fit for me as you are, you know, I am for you. And the ability to examine yourself that way. So robust programs. So integrative medicine programs. Andrew Weil is really the father of this, you know, this type of style of medicine. And he introduced the first integrative medicine program in 1982. That was actually you know, an encompassing program. 50 different programs are available throughout the United States.
Wow.
So he really is robust. When you're looking at certifications, you want to see, do they have a robust peer group or mentorship group? Because there are specialties within this too. Believe it or not.
I believe it. Makes sense.
Which we try not to subcategorize anyone out early on. You know, I try to pull in my colleagues as a team approach. So I would want to know, do they work with a team or do they do everything on their own? And if they say they are, you know, solo, they don't have anyone that they work with, they don't, you know, they don't discuss you or their clients as a patient in a team setting, I would be a little wary because you can't know everything. You will never know everything.
Not supposed to.
You're not supposed to. I would be a little wary if there's a lot of diagnostics being done in the beginning for a lot of different body systems without clear direction. You know?
So by that you mean like lab testing.
Correct.
You need to do, this isn't covered by insurance.
Correct.
$5,000 for this, $100,000 100,000.
Yeah. Wow.
Oh,
I mean,
well.
that would be a really robust program.
Yeah.
I would hope they'd come and cook all your meals for you. You know?
Right, and clean my house.
Right, exactly.
Actually, I would feel better
Right,
too.
exactly. Yeah.
When
So,
you're saying
I
diagnostic,
mean, that might work.
Yeah.
Yeah.
Right.
Right. So,
Coming soon now.
I mean, you could spend literally tens of thousands of dollars on all the different testing that is out there.
Right.
You know, some of it is well vetted. Absolutely. Some of it, you know, I completely support. But it's really timing. It's choices, and where, you know, where to put that money doesn't really come to fruition often in the first 1 to 2 visits. I mean, generally, you know, I need a little more time with you to really figure out what we're going to do. You know, and the way I work it, when you come to see me, you know, I usually speak to you on the phone, or one of the other folks from my office, which is either one of my ICU trained nurses, who also helps run, is really the founding member of the infusion side. So she will speak to you and kind of give you an overview of what we do, or my other partner, Wes. So my ICU partner is Pam. She's lovely. And my NP partner is Wes.
Hey guys.
Hi guys. And he may get on the phone if I'm not available. If the prospective client wants to speak with me, I would gladly return a phone call, and just to see, you know, as you know, we call it discovery calls, to see, you know, are we a good fit? Is something that we offer attractive to you? You know, and do we have an idea of what we would do for you? A loose outline. You know, so that's the first like contact point. Other than, you know, looking at our website, or, you know, watching this podcast, or word of mouth is, Porchcast. I'm sorry.
We're redefining
See,
it.
now I got in trouble, but I didn't get in trouble till now.
What?
This was good.
What?
Until now.
Oh, my ADD just kicked
Yeah,
in.
no, yeah. You said we need to talk. We need to like make sure that we know what that is. Yeah. Well, I appreciate it. Porchcast. I love it. So that's, you know, so that's a way of entry. You know, we don't automatically book online.
I like that.
I did that before, and I just didn't think it was a good fit for me. Part of it is because, as you already know, I'm not a big fan of technology. It's not something I gravitate to. I really celebrate the people that are in my business or in my life that can do that and help me, because you know, I'm more, you know, I like the people.
The calendar. You can see your calendar.
Oh my gosh, yeah. My planner is interesting.
Yeah.
It's probably about 2 inches. Yeah. Oh yeah. So we're working on starting January stuff already. It's important.
I respect it.
So you get on the schedule with me, and then that first meeting, we decide, like, what do you really need, you know, and what has been your experience, and if you have things that you've had done in the past, like lab testing, imaging, you know, failed therapies, I want to know as much about that as I can, because we don't want to do the same thing over again.
Right. No
or
problem.
maybe it wasn't done properly, or maybe not done long enough, or without the right environment. So, and then I'll explain if I want to revisit that again.
That makes sense.
You know, and then we decide together what the plan is. And that's the best.
That makes sense.
Way to do it.
I think what I enjoy most about you, a lot of things, but one of the things in this capacity is it's a fit both ways, right? Because if you are having a client who's not going to listen with you, or fight with you, or doesn't try, whatever the reason, it's not the right fit.
It's not. And, you know, a lot of people, you know, I see a lot of chronic pain disorders and mental health on my in my infusion patients, and we do ketamine infusion for mental health and complex pain disorders. And those folks have a lot of issues from the past, because, you know, they're treated a little bit differently. And we all know this, you know, whether we all want to admit it or not, it is true. And I really want to listen to their experience of it, because I don't want to be someone that causes you medical trauma.
I think that's a really responsible thing to do.
And I think it's incredibly important. And it's very important to me, because that would really be difficult for me to sit with. You know, so I tell patients, if something occurred here during your visit, it could be they're blowing leaves outside. It could be, and that's vibrating.
The uncontrolled,
the uncontrolled things. Let me know, because we are in full control of our environment. So we can make changes to make it more pleasant. You know, if I'm addressing you in a way you don't want to be addressed by, I want you to tell me. You know, that's important to me. So all of the things, you know, and that's important, that your experience is a quality experience.
I think that means a lot to people, and especially in a system where those things can't be touched because there's just not even time.
Exactly.
Right.
I mean, they can't even address it.
Yeah.
They're just trying to get through the day.
Truly.
Yeah. They're trying to get through the day.
Truly. And now, cash-based, insurance-based, what does it look like for clients in that functional medicine space?
So routinely, functional medicine and integrative medicine has been cash-based, cash or credit, or also some of these, care credit type programs.
Okay.
If you have insurance and you have a flexible spending account, we can accept that. We can accept that. So that is,
well, that's a fun secret.
Yes, that's a viable payment. We've discovered, even like if we're looking at the infusion side, infusion reimbursements, if they did go through historically, they are really not going through now, or if they are, the reimbursement rates are very, very poor. So what's happening is people are actually going out of business because they're not getting paid, and some insurances also don't see these things as medically necessary. So even though there's robust data, randomized multi-system studies that say the opposite to that. So we are a cash-based service. So our ketamine clinic is, our integrative medicine and functional offerings are, and we also have a direct primary care membership model, which is a membership-based primary care offering, and it is not insurance-based, but if you have insurance, you can use your lab benefits, you can use your pharmacy benefits, you can use your diagnostic benefits.
That's huge.
So all of my scripts, still are utilized in that way. So really what you're paying for is the visit.
Okay.
And it's a membership base. So you pay one flat fee per month, and there is no upcharge for anything direct primary care related, which would be, sick visit, pre-op, post-op, annual wellness,
someone died. I need to talk to somebody, right?
Exactly.
Life events, right?
So that's all included. That's all included in your membership. And there's, there's couples membership, family membership. If you have a family that is not, a typical family, which, I have a non-typical, I have a blended family. And if there's a question about how does your family fit into these buckets, you just call us and we'll let you know.
I love that.
So we really try to make it, as applicable to as many people as possible. And we also offer the services to small businesses that can't afford to provide insurance coverage for their employees. Or if what they've provided for them is, high deductible plans where, these people are going to urgent care and the ER and they can't find good primary care service, please give us a call. We can work with you as well and offer like something through, as a small business offering.
I love that.
Yeah.
Cheryl. Well, the street lights just came on.
I know. Oh my gosh.
So I think
they might go for us.
Go us. You know what?
Go us.
Go us for Porch After Dark.
Exactly.
I love it. Thank you for being here.
Thank you so much for having me. I would love to come back.
We've had part 2 and part 3.
Yes.
Right? Yes. I can't wait for our Guess the Diagnosis day.
I know, right?
You guys can send us in your questions, your ailments, your symptoms.
Please do.
And we can have Cheryl do a Guess the Diagnosis.
Yeah, I think it'd be fun.
It sounds like a lot of fun.
Yeah.
We do a little PT
exactly
collaboration here.
Right. Absolutely.
This is going to be great.
Awesome.
Well, how do people get in touch with you? I will link it, but
yes. So we are South Jersey Integrative Health. Our website is www.southjerseyintegrativehealth.com. All of our emails are on that website. Our phone number, if you want to have it now, it is 856. Oh my gosh, I just forgot my phone number. 856-535-3100. That is correct. Wow.
If it doesn't sound right, that's not correct. And she gave you the Zeus number.
Exactly. So that is the correct number. And if you want to email me directly, my direct email is Cheryl@southjerseyintegrativehealth.com.
Perfect.
And you can catch me there.
Perfect. Well,
Awesome.
Cheryl, thank you for being on the porch. Much
Thank
appreciated.
you.
And I can't say enjoy the rest of your day. Enjoy the rest of your evening, because now we're definitely caught that
this is
not
true.
the morning.
Very true.
All right. Well, thank you all for being here. Thank you all for listening, and come back next time. Have a good one.
Thank you.